So today I'm going to talk about back rehab. So if you've injured your lumbar spine, you've got a herniated disc, an annular tear, sciatica, degenerated disc, our back exercise program is basically designed to strengthen the muscles in the front and the back to work as a combined unit to take the stress off your spine to decrease the pain. And it's basically a 5-level program. You start at level 1, 1 is the easiest, 5 is the hardest. 1, you just establish a neutral, pain-free position. So it's not about doing 1,000 sit-ups where you can stress the back. A lot of people go to physical therapy when they're having back pain and they say they can't do the therapy because it's causing pain. And if you're trying to twist and rotate through your spine, it can cause pain. So our program is designed in level 1 to establish a pain-free, neutral position and maintain that. And you need a physical therapist or an athletic trainer to watch you do the exercise and teach you how to do them so you can properly maintain that position. Because once you're doing the exercise, if you lose that position, you need someone to tell you, stop, it's not working, start over, and stop that exercise. It's about endurance. You have to build up the strength and the time to repetitively do it without losing the position. Therefore, you're not going to cause pain and you're not going to aggravate the stress on your spine. So level 1 starts in just neutral, finding that position. Level 2 gets harder, and then as this graduated progression takes place, we know that as your core muscles are getting stronger, we typically can allow you to do more activities because we know the muscles are going to protect the spine and make it safer for you to do those activities. So when you get to level 2, that's when people typically can do an elliptical, swim, bike. When you get to level 3 is when you can start to run and start doing more rotational exercises and sport-specific exercises. So for the athletes we treat, we want them to get to a level 3 before we let them to start to go back to their sport activities such as throwing, hitting, skating, running, shooting, and doing everything they need to do. So they get back into a level 3. Level 4 is where they need to be before they can really go back and practice with the team and do all their sport all out. And really in the weight room all out, they need to be at level 4 first. Level 3, we let them start doing lightweight weightlifting and rotator cuff exercise in a more neutral position. Level 4 is all out practice, and they got to be at level 5 before they can get back to their professional sport. So the quantitative program allows us to regulate the rehab and ease people back into their activities. For athletes, but also just everyday people, that's how we know you're safe to go back to certain activities. And the whole program's in our Back Doctor app, which is the free app in the App Store. We have a PDF printout of the program if anybody ever wants one, but it really allows us to guide the rehab to get people safely back to their life and all their sporting activities.